The inaugural Africa Health Indaba gets underway next week, and the central focus is on the continent's ability to collectively manufacture its own medicine and healthcare products. The gathering brings together high-level government representatives and business. So let's find out all about it with Dr. Bandile Hadebe, who speaks for the Africa Health Congress. Good evening to you, Dr. Hadebe, and thank you very much for your time. This is quite a crucial get together, especially given what happened during COVID, the unavailability of vaccines, the fact that it exposed the lack of our manufacturing capacity, but also on a number of diseases that Africans are facing. We should be harnessing the opportunity to make and provide our own medicines that can also be, accessed by all communities much cheaper.
Yeah, no, certainly. And I think what we really are trying to do with Africa Health Indaba, which is really a baby that's born out of Africa Health Congress, which has been running for 13 years, is that within Indaba, we want to drive strategic conversations that put Africa in the forefront. Healthcare tends to be a very crisis-laden environment where we are constantly blowing fires left and right. I mean, your previous interview was precisely about that blowing of fires. And what we are hoping to achieve with Africa Health Indaba is to just give leaders a pause to apply strategic thinking into the future of healthcare. And one of the issues that we really want to drive around is how do we position Africa competitive in the global health economy? And the issues around manufacturing, the issues around local hubs across the continent that are focused on different products and services in the broader value chain become central into that conversation.
Yeah.
And that's what we to drive Indaba.
I'm worried that my next question is going to be a little inelegant because maybe it is asking you to put together and count a number of things, that shouldn't be counted together. But the question is, what is and how would you measure the dependency of Africans on, products and services that are coming outside of the continent? In other words, exposing our dependency on things that, that we don't necessarily have control of inside on the continent.
Yeah, so I mean, the example that you touched on, the COVID situation, it was a real wake-up situation for us. If you consider the fact that we were even in the back of the queue for something as simple as gloves. I mean, by the time we started speaking about vaccines, Africa was a non-entity in the conversation, and our leaders across the continent really needed to push back and fight for us to actually have a seat at the table on that vaccine program conversation. So if you look, for instance, in the pharmaceutical space, you've got countries like Kenya, South Africa, Morocco, Egypt that are really having a robust conversation around the production of pharmaceuticals. But if you look underneath the bonnet, 80% of our pharmaceuticals across the continent still come from elsewhere, from India, from China, from the US, from the UK. So even as we actually have a very robust manufacturing market in South Africa with multiple significant local players, if you're looking at things like the inputs, the molecules, the APIs that are used for pharmaceutical manufacturing, we are really nowhere in that picture. And that's what we need to solve for. We've got a 1.3 billion population. That's a significant market. If we start looking at ourselves as an integrated market and our ability to then provide and manufacture for that would actually drive our competitiveness globally in the health economy.
And here's the thing, I mean, you talked about capacity. We certainly have the ability to do it. We've got, major pharmaceutical companies on the continent, in fact, right here in South Africa. We've got groups of scientists who are making world-changing breakthroughs on major global diseases like HIV/AIDS. So the capacity, the talent, all of that is there. What are you hoping for as an outcome of this conference to really connect those capabilities together so that we can begin to sequentially see the African continent going online in terms of providing and taking care of its own health?
So I think we need to be intentional, right? So a strategic decision as wanting to be a global competitor in manufacturing of medical products cannot happen as an oops. India, for instance, as one of the classic examples of how it became the pharmaceutical hub of the world, was a very deliberate and strategic decision that was taken. So Africa also needs to be very deliberate around that. But we also need to start putting in place real, tangible initiatives. I mean, if you look at the fact that the first real decision around pharmaceutical manufacturing in Africa was taken as early as 2007 in the context of NEPAD with that pharmaceutical manufacturing action plan for Africa. And almost a decade later, nothing real has come out of that. So beyond the plans, beyond the talks, we need to put in place tangibles. And one of the tangibles that we really are trying to advance across the continent is this establishment of these special economic zones in different countries that are focused on health products. So you're going to have one in South Africa that's focused on a particular product. You're going to have one in Tanzania. You're going to have one in Nigeria that's focused on a particular product. And those centers of excellence then become the drivers of how Africa is then able to supply itself, but also to supply the rest of the world.
Yeah, it sounds really, really exciting, and an opportunity to do the things that we've been talking about for a long time doing, which is reach a position not only of manufacturing self-sufficiency, but even then to be able to sell our goods and services and our talent to the rest of the world. So thank you very much for sharing the details of the gathering. This is the Africa Health Congress spokesperson, Dr. Bandile Hadebe, talking to us about the inaugural Africa Health Indaba 2023.